The National Institutes of Health have awarded a grant to Posit Science for the development of a model community-based program for dementia prevention in collaboration with the YMCA of San Francisco. I spoke with Dr. Henry Mahncke of Posit Science and Chip Rich from the YMCA of San Francisco about the project.
The idea of what we're doing is this brain health program. And the idea here is, hey, there's a lot of evidence-based science around how people can reduce their risk for dementia and Alzheimer's disease. We now know things like brain training and physical exercise and better diet and better sleep, a host of other things can lower your risk for dementia. But a lot of that research kind of sits in the academic journals. It's hard for people to actually get it. And in my own life, my mom is 85. She lives in a wonderful residential community in Washington, D.C. And she takes classes in things like Latin or the history of World War I. But there's no class she can take on how can I build a stronger, more resilient brain to resist Alzheimer's disease. So that problem had been on my mind for quite some time. And then very fortunately, I was introduced by a colleague of mine at Posit Science to Chip here at the YMCA. And we came over and had a wonderful first meeting, Chip, with you and your team and talked about the incredibly good work you're doing in community-based health, which I'll let you say a few words about in a moment, and thought, hey, why don't we put together the science of reducing dementia risk with the good work of the YMCA and being able to reach out to people in a community-based health program. And Chip, how did that first meeting go from your memory?
Well, I think it was great. I think at the Y, we are really trying to focus on public health issues in a preventative way. So, community health issues, diabetes, we've got a history there, recovery work with cancer survivors and blood pressure. And so it was a natural for us when Henry and his colleague came to us and said, we'd like to partner with you looking at prevention type services for folks that are at risk for developing later in life dementia. So it fit perfectly into our portfolio. And a big investment that the Y is making right now is to make sure our capacities reach all segments of the community. So Henry and colleagues had the intervention. We had the know-how on some of the things that they were looking at incorporating, and we had the desire to add this to a portfolio of prevention, community-based health programs. So it was a match made in heaven right from the start.
According to the National Library of Medicine in 2021, an estimated 6.2 million Americans aged 65 and above are living with dementia. They also estimate that the number of dementia patients could rise to 13.8 million by 2060 if there are no medical breakthroughs. Projects like the Dementia Prevention Project are here to prevent this from happening. I asked Dr. Henry Mahncke how he thought America as a whole is coping with dementia.
The challenge for dementia in America, but this is true worldwide, is on the average, many societies are getting older, and that means that the number of people who have dementia is going up. Our bodies are lasting longer thanks to wonderful healthcare, but our brains are not necessarily lasting longer. And the big challenge here is we've approached this, as a pharmaceutical problem. Like, hey, let's get a new drug that's going to treat or prevent or cure dementia. And hey, that work is impressive. The scientists involved are doing great work, but the challenge is that it just hasn't paid off so far. You look at the last 20 years of drug development in Alzheimer's and dementia, and we have no new drugs that can treat this disorder. And that really tells us that, hey, we need to start think of this as a healthy brain resilience problem, not as a disease that's necessarily going to be treated with a drug, but what can we do to make our brain stronger and more resilient, before we even go on to the early stages of dementia. And that's a huge shift for any society, in America, but certainly in the EU and the UK. We often think about health problems as, well, what drug treats that? Which doctor is going to prescribe you which drug to help you with that problem, and then we can wash our hands of it. But so many challenges that actually face our society, whether it's dementia or diabetes, these are actually issues that are going to be better addressed through building healthier and more resilient bodies, or in this case, brains. And that's going to be a huge shift for how we think about making people aware of the problem, how we treat the problem, how we have society pay for the problem. And so there's a lot of changes that have to require, but this is really how we're gonna tackle dementia. I mean, Chip, what have you seen at the YMCA from a similar problem around diabetes?
I think, Henry, you really nailed it. We don't need to be passive, waiting for a drug. And I think Americans, especially, like their somewhat opulent lifestyle. But I think it does, as Henry said, go across the UK and EU. And so we need to bring people along to the notion that living well late into your 70s and 80s means taking a degree of responsibility. And so we're looking at behavior change more than education. And that's one of the things that the Y really specializes in. We know how to support people in changing their behavior. And a lot of that is done through developing communities where we hold each other accountable, where we're encouraging, we're partners, if you will. So the work here, I think, is for people to learn to be responsible and proactive and hold themselves accountable.
The project is based off of the successful diabetes prevention program that was developed by the YMCA. The DPP helped to reduce an estimated 58% of new cases of type 2 diabetes for those who took part. I asked what percentage they expected the dementia prevention program to achieve.
The diabetes prevention program, as you call out, it sets the mark for how big an impact we can have on what's thought of as a and what is a metabolic disease, right? And what that tells us is the kind of behavior change programs that Chip just mentioned. We can think of them as medicine, right? They are treating the disease, they're preventing people going on to it. I'm very optimistic about where the brain health program is going to go. Now, I'm a scientist. We got to build the program. We got to collect the data. We got to measure the results. But a recent article in Lancet, a UK-based publication, as a well-known one, as they estimated that something like 40% of dementia cases probably arise from what they call modifiable risk factor. And what they mean are things like Chip and I are talking about, things like not getting enough exercise, not getting enough brain activation and brain training, not getting enough, having poor sleep and poor diet. And so I think that sets the bar to say, well, I think we're going to be able to, over time, lower dementia incidences quite substantially where this program starts to be able to get advantage of it. And again, if there was a drug that was going to reduce the onset of dementia by a 40% risk factor, it would be the biggest piece of medical news in the past 20 years. And I think that working together, Posit Science and YMCA are going to be able to put something together that's going to have a similar impact like that.
The project is set to get underway later this year. Henry and Chip talk us through the process it'll take.
Yeah, we just got the funding announcement from the NIH, so we're absolutely thrilled that the National Institutes of Health sees the promise in this kind of work and has put some dollars in to help make it happen. And, we're going to spend about the first 6 months building out the curriculum based on the science of dementia prevention and based on what the YMCA already knows about how to drive behavioral changes in its communities. And then, Chip, do you want to say a few words about the classes we're planning?
Well, I think that Henry, again, you nailed it. This isn't one of those things where we want to leap before we've done the background work. We understand that for this, really whether it's a prescription drug or something like diabetes prevention or brain health, a lot of what's going to determine our long-term success is the sustainability of behavior change. If you think about any of the medicines you take for blood pressure or cholesterol, if you take them for a week and get off of them, they don't help. And I think likewise, when we're looking at brain health, we need to understand not only what changes we want, but how to create an environment in which those changes become part of a lifestyle. So our work right now is building the curriculum, understanding the proper amount of sleep, nutrition, I think is a big thing that we're looking at, exercise. And so having a curriculum that works as part A, B, understanding how do we make this an institutional change. We have to be especially creative, understanding that COVID is likely in our midst for the foreseeable future. So what that means is disruption, perhaps in in-person classes that people may attend. So how do we create a platform for people to continue their work, continue the social network if they're down for 2 or 3 weeks with COVID? So those sorts of nuances are really important to us, as well as making sure that we have really tightened up our hypotheses as to exactly what needs to happen. Where are we when we look at compliance, when we are dealing with spouses or with significant others? What sort of things are going to keep behavior change in place for the long haul? So those are all parts of the formal curriculum, and then just sort of thinking through, how do we roll this out? So Henry's right. The time, we're working on that now. We have great partners there. We have great learnings from diabetes prevention. And so we're all anxious to get it going, but we don't want to blunder into this.
But why San Francisco? Chip Rich talks us through why they were the perfect partner for the project.
Part of why I think Henry looked at San Francisco as a perfect partner. We have a number of broad-based community health agendas and initiatives. And those aren't just physical health, but mental health, family support, poverty abatement, food security. So the sorts of reach we have into all pockets of the community, I think, make us an attractive partner.
We're going to run these first few classes as part of this initial phase of it, but what's the world we want to see? I think we want to see a world where no matter where you are in the community, and regardless of your social status, your income, or your technical facility, you can hear about a program like this, whether you're seeing a flyer on a community bulletin board, whether you are, out in your community and attending a street fair, and there's a booth talking about health-related things, and someone gives you a folder and says, "Hey, why don't you come to this class next week?" All the way up to maybe you're visiting your doctor, and your doctor says, "Hey, if you're worried about, maybe slowing down a little bit, why don't you come to this great class that the Y offers?" And through all these channels, we really should be able to reach all these people. And because the Y's great experience and really meeting people where they are, as Chip has said, we can make this program accessible to people from really all walks of life.
The project may be taking place in San Francisco, but Henry and Chip have high hopes that the program can go global.
So another, I think, strength of the Y is that we have a federated model. There's 2,000 Ys spread across the country, associations. Each association has, in San Francisco, we offer programs at about 130 sites. So do the math of 2,000 Ys with multiple sites, and you really talk about an ability to penetrate pretty much the entire country. There's not a red state or blue state issue in America. When you look at the YMCA, we are everywhere and broadly supported. And I think also what makes the Y an attractive partner is that a lot of what we do free of charge. So the Y has a tremendous fundraising engine that allows us to bring, whether it's diabetes prevention or cancer recovery, or in this case, brain health, to all segments of the community. Now, that said, I think it's my dream, and probably Henry as well, that we would come to a point in time, 2 years, 5 years, 10 years in the future, where doctors could write a prescription, just like they do for an antibiotic or something like that, that our insurance companies would start to look to pick up, so that every possible conceivable barrier would be removed.